Good afternoon, everybody. We're going to be starting our webinar on prompt. My name is Kathy. I'm chair of NAPBC, and I am running the prompt study. Here's an outline of what we will be talking about today. First, two housekeeping things. Sandra, who many of you have seen on this webinar, is not feeling well today, so Riley has generously taken her spot, and he will be helping us with the questions. The ACS staff was told there might be a cybersecurity sort of warning or alert. It's just a practice. We don't know when that will happen, so I guess there is a possibility it could happen during this webinar, which means maybe the webinar will be disconnected, maybe it won't, but we just wanted to warn you that if something happens and you lose connection to the webinar, that's what's happening. So here's an outline for today. We'll talk about a QI template correction that, and I don't recall who it was, but somebody sent me an email and astutely pointed out there was an error in the QI template, so we have corrected that. A couple words about the feedback survey, the submission of 2022 data. We are going to extend the end of year deadline to January 15th. Just to avoid holidays, the new year, so forth and so on. So technically, all of the prompt QI templates will be due by January 15th. We have a new platform that we will be rolling out. This will house all of our information, all our webinars, IRB, all the documents, and there's also what we call chat forum for you to communicate with each other, and I'm going to go into more detail about that. And then lastly, I'm going to finish up with a prompt patient validation study that we are now conducting. So first, the prompt QI template correction. Somebody astutely pointed out that the problem statement was being incorrectly described here. In this old version of the QI template, the problem statement must include numerical baseline and goal metrics and anticipated timeline. This really pertains more to the aim statement. And as I outlined in a previous educational webinar, the problem statement should outline who is experiencing what and where and when and why we care. So an example, patients at Hospital X are experiencing excessive wait times for a screening mammogram at the breast center over the past 2 years. These delays have led to increased patient anxiety. So that's really what your problem statement should look like. We're not really talking about numerical goals or aims. That would be more in the aim statement. So we have corrected that part on the QI template. The feedback survey, you should have all received this survey. It should have come as a red cap survey link from brp@northshore.org. Would like to get all of these back by October 23rd because I'd like to present this at our next webinar, which is November 13th. So just a plea to please fill this out. I'm not requiring you to fill it out, but I really do want to get feedback on the prompt study so that we can either change things right now or change things for the future to improve the experience. The 2022 data, you should all have received an email to submit your 2022 data. It's not required. You don't get any additional credit. We did have a deadline of September 18th, but we are extending that and accepting data submissions up until October 16th. Here are just some study stats about the prompt study. We have 322 sites officially enrolled. Only 51 have submitted 2022 data. We were hoping to get closer to 100 sites. I know that's difficult to submit that data, but whatever you can do, please do submit. And again, you don't have to submit the 2022 data. We just wanted to provide that for sites so that they could use it for their projects. The feedback survey, we have received 98 of those, so approximately a third of the sites have submitted feedback surveys. I would really like to bump that number up closer to a 40 or 50% response rate. So please, if you can get your feedback surveys, and I would greatly appreciate it. And we have close to 110 sites that have submitted their prompt QI templates. I can't tell you if they're all complete, but we do see some activity on the prompt QI templates for approximately 34% of the sites. And again, As you all know, the templates are not going to be due until January 15th, 2024, so you've got time, but I just thought you would be interested to see where people are at. Let's talk about the Salesforce platform. This is a new platform. We really wanted to enable sites to talk with each other, have sort of like a forum that people could get advice from each other on what they're doing, what sorts of interventions are they working on that's helping with their timeliness. This will house all of our documents. Everything that we have on our current website will go to this platform. We're going to keep the current website open, but just so you know, we'll be on this new platform. It is public access. You can access it at this email address here, NSHS, that's North Shore Health System, .prompt.com. So remember all of those dots. And there is a mechanism that we can send announcements through this platform. So if you just go to the website, this is what you'll see, the prompt study. If you go across the top here, you'll see the study timeline, the instructions, the webinars, the data, the IRB forms, the FAQ, and importantly, the forum. So the form is something that you have to sign up for and register for. And you will receive an email on October 16th from Salesforce to be able to register for the form. And Salesforce will assign you a username, which is essentially your email, followed by the word prompt at the end. And then you create a password. And once you do that, then you can officially sign on to the website and get access to the forums. There's going to be a forum or a forum group, I guess I should say, for each of the 4 timeliness metrics. And you'll be assigned to the one that you signed up for. So either screening to diagnostic, diagnostic to biopsy, biopsy to surgery, or biopsy to neoadjuvant therapy. You can only post a comment on the group that you're assigned to. You can look at other groups and their comments. You just can't post on those groups. If you have 2 different timeliness metrics that you've been assigned to, then you'll get access to both of those groups. And in your group, if you post a comment, then everybody else in that group will get a notification email that will say somebody posted to the group, and so then you can go in there and see what people posted. There's also a prompt research question and answer form group that you can post a comment or a question that will go to everybody, and anybody can post to that group. This is what it will look like when you sign in. So you'll go to the public access site. There's a place in the corner where you can sign in. This will be the screen that you'll see. Here's the chat function in the lower right-hand corner. If you click on the heading Forum, it will take you to this page. And you can see here that the 4 timeliness groups are listed here. Time from biopsy to neoadjuvant therapy, time from diagnostic mammogram to biopsy, biopsy to surgery, and screening to diagnostic mammogram. And so you're assigned to one of those groups, and so you would go into that group and you would post your comments or questions. And as I mentioned, there's also the prompt research questions and answers, which anybody can post something there. So once you click on your group, then you'll see this, and this is what you would click on post, and then you can put your questions and comments in there. There's no cost for this. It's all covered by the study. And again, you'll get an email from Salesforce on October 16th so you can officially sign in. And hopefully everybody will participate. The goal is just to be able to enable all of you to be able to talk to each other about your different projects, things that have worked, things that have not worked, and to try and get ideas from each other. Let's move on to the prompt patient satisfaction with timely care survey. We're working on validating a patient survey that your sites could use to determine patient satisfaction with timely care. This study is an IRB approved study. It's approved at our IRB. You do not need to do anything. You don't need to go to your IRB. We are involving only about 6 to 7 patients from the qualitative interview study. and they will fill out this survey that we've put together, and then they'll undergo some more questions, what we call face validity, with Dr. Tammy Stump. And what we're hoping is to produce a short patient survey that you could use with your patients to determine if they're happy with the timeliness of their care. So that is all I have for now. Our next webinar is November 13th. We're going to hear a presentation from a site about their experience with the prompt study. And then I'm also hoping to present some of the feedback survey questions that we have from you. So we have plenty of time right now to answer any questions that you may have about prompt. I'm going to pull out my thing here. I'm going to have Riley go through the questions and then I can answer them. And I think I had mentioned this on a previous webinar that I'm happy to look at your template, help you, give you feedback. Do you think you're on the right direction? Do you have questions about it? Please just let us know at brp@northshore.org. I'm happy to help you. I've had a couple sites reach out to me already. Whatever I can do to help you. So let's go to the questions. Riley, are you able to see the questions?
Yes, I think so. Let me pull them up really quickly.
Okay.
Okay, so the first question I see is, will the patient satisfaction survey be available for us to use?
Yes, so whenever you design a survey, you have to what we call validate it. So you have to make sure that the patients understand the questions are really asking what you want them to ask, the format is suitable. There's a whole science behind this. And so that is what we're doing with this patient validation study. We're trying to validate the survey that we put together. And the survey we put together, I think it's about 12 questions. It's based on the interviews that Dr. Stump conducted with all of your patients. And so we have to make sure that those questions make sense, there are no spelling errors, the format is acceptable, that patients understand what we're asking. So that's what this patient validation study is. And hopefully that will only take a couple months to be able to interview those patients and understand if they understand the survey. And then we would make it available to all the sites to use. Okay.
Okay, the second one is, can you please verify when the prompt QI template is due?
So I think I had originally said it was going to be due at the end of December, but of course we have the holidays and the new year, and it's just obviously a very crazy time of the year. So we decided that we would push back that date to January 15th, 2024. So would like all those prompt QI templates in by January 15th, 2024.
Okay, and then also, do you have a date yet when the Salesforce website will go live?
That will go live on October 16th, 2020, this year, October 16th, so 1 week from today.
Will we get credit for the research accrual standard?
You only got credit for the research accrual standard for last year. You do not for 2022. You do not get credit for 2023.
We have limited our study to those diagnosed internally, not those from other counties and states or countries and states. Is that okay? Those patients have travel and logistic barriers.
Yeah. Yes, I think that's fine. Obviously, as long as you're following the template and doing all the steps that you need to do to look at your internal patients. And maybe in the future, you might want to do the same study looking at those external patients and trying to understand ways that you could help make care faster for them. But it's fine to focus on the internal.
Okay. Were there any established office hours for prompt QI assistance?
No established office hours. I'm happy to do that. I think how we were going to do it was asking sites to email us at brp@northshore.org, and then I could figure out a time to connect with you. So we could do sort of a one-on-one, and it you know, could just be 20 to 30 minutes. It sometimes helps if I'm able to kind of look at what your questions are ahead of time, and then we could set up a time to talk.
Okay, will we be able to print and review the template with staff before we submit it?
Yes, so Riley, maybe with the QI template, if somebody is halfway through it, are they able to go in there and pull it up and print it?
Yeah, they should be. Well, there is a save and return function, so you can fill it out before submitting it and save it and everything. And I think you should be able to just print, you can probably print the web page. I don't think there's a print button during the survey, but if you hit Control P on your browser, or maybe like there's probably 3 dots on the corner that you can print the web page that you're on, and then you can review it with whomever you'd like.
Do we have the actual PDF file of the QI template? Can we maybe we can make sure that's uploaded to the Salesforce platform and the website, so if people just want to look at it in general?
Oh yeah, that should be up there, and I'll confirm with Alicia and make sure that's on the Salesforce website.
Okay. Okay.
And then oh, and also when you submit, you should be able to print and download a copy of your filled responses too.
Okay. Okay. Yeah, it might be for sites that maybe have filled out half of it and then they're trying to figure out the other half, you know. So
yeah,
that's the question, is can they print that with half of their responses filled in? But maybe not. So maybe if we can at least get them access to the PDF of the template, then they can look and see where they need to be.
okay.
Okay.
Let's see, next question. If we have finished our QI study and submitted the QI template, how and when do we know if we receive credit for participating in year 2 for standard 6.1?
So I think we'd probably do similar to what we did for year 1, where you got sort of a confirmation email from us that you had participated. And that's what we would do for year 2. And then you would upload that confirmation email into the PRQ. Now, I think that the site reviewers may also want to look at the prompt QI template. So let me look into the PR. I'm assuming the PRQ will have a spot that you can upload your prompt QI template, but I will double check on that.
Okay, and then lastly, we have a couple people asking if we can just send out a copy of the QI template to everyone.
We can do that. Can you do that, Riley? Is that okay? Yeah,
do you want to do just like an email blast like we normally do? I can send you.
Yeah, let's just do that, and then everybody has it. That's fine. And then we'll put it on the Salesforce platform as well. So.
Okay, and then how many NAPBC sites are there in total? What % participated in the prompt study, if you know?
So we have approximately 550 sites. So if all 322 sites submit all of their stuff, which, you know, I understand that may not happen, then we would be at 58.5% participated in prompt. 322 sites participated out of 550. So that's pretty good. Okay.
I don't see any more questions.
Yeah, I don't either. If any other sites are interested in presenting their experience with prompt, even if you're not finished, if you're still halfway through, that's completely fine. Please email us at brp@northshore.org and we'd be happy to have you present. I'm hoping that for the February ACS Cancer Conference meeting in Austin, Texas, that we'll have some opportunity for prompt sites to meet with each other and talk about their projects as well. And we are also in the process of writing up a paper with all of the timeliness metrics data that you generously all provided us last year. So we're in the works of putting a paper together that will list all of those numerical data and then stratifying it by facility factors and looking at which facility factors are associated with longer or shorter timeliness for all those 4 metrics. So we'll let you know when we get closer to submitting that paper. I think there's one more question here. Is there a way to see if our site submitted 2022 data? And if you email us at brp@northshore.org with your site name and ID number, then Riley can look that up and let you know if you did submit your 2022 data. Okay. I think that's all we have for now. Any other questions from anybody? Okay. Well, we'll see everybody on November 13th. And again, I will present some data from the feedback survey, and then we'll hear from a site. And maybe we'll have a little bit more information on the patient validation survey. And we'll go from there. But thank you all for joining, and I'll give you back some time to your day.